Addressing COVID-19 and its rapid spread, Dr. Priya Mukhopadhyay provided insight into tackling the increase of emotional distress, anxiety, and many other responses which are impacting the everyday lives of many Americans, including grieving the lives lost to the disease. She also discussed the need of PPEs and social distancing while giving advice for patients that have mental health illnesses and a take on breaking the stigma against mental health in South Asian communities, especially during this outbreak where self-care is essential. Here is a segment of our interview with Dr. Priya Mukhopadhyay with her expertise in psychiatry.
Most of our cases right now are somehow related to COVID, emotions as a result of the pandemic, trauma, like I mentioned, nightmares, loved ones, losing loved ones due to the pandemic, and more than anything, though, I'm talking with my coworkers. I think the influx of trauma and mental health cases after the pandemic, I guess, eases off is gonna be ridiculous. Like, we're expecting a huge influx of patients after all this is done, because you're kind of forced to stay at home, forced to deal with your feelings in the way that you deal with it. But once everything is open and you're able to come in, I feel like there's going to be an influx of patients.
So if someone is suffering from mental health illness right now, say they're in treatment or they're taking medication, what are certain factors that, according to you, that they should sort of look out for? And do you consider them at high risk, perhaps, during this pandemic?
It's a very difficult time. It's tough because a lot of people find their psychiatrists and their therapists as like the highlight of their month, the highlight of their week. It's a place for them to go. It's their safe place, and they're not able to have that. So I know a lot of people are struggling. And in terms of resources that are out there, I'd say to make use of everything that's there. Unfortunately, the help isn't as accessible as it used to be because of the lockdown. But a lot of people have had to make do with like self techniques and self relaxation activities. But I would say take advantage of your outpatient providers if you have one, as well as the crisis hotlines. If you feel like you need help, you need to talk to someone, you feel alone, don't be afraid to call and reach out. It's a phone call away. Our phones are working, thank God. So I would say make use of those resources. If you're on medications, do not ignore the fact that you're running out of medications. You are still able to get your medications. And if you don't feel safe going to the hospital, then you can call in and get those medications. We're doing assessments over the phone for people that are established patients or people that we can have some proof. And proof is easy to get. We call up the pharmacies, we call up their outpatient doctors. If you need a refill of medication and there is some proof, we'll give it to you. It's not, don't think it's impossible. People thought that this was impossible pre-pandemic, but we're making a lot of changes and tweaks just so that the things that are necessary are accessible to our mental health clientele.
Definitely. So that means there is patient care fully available for people that are seeking treatments or are currently involved, and they just need to basically contact them. In terms of living with mental illnesses right now, and then the family taking care of somebody or having someone around that you have to take care of, what are your comments in that sense? What should they be careful about perhaps right now while we're in the pandemic?
Right. So, like I said, stay on top of the medications. If you notice that your loved one or your family member is running out, make sure you touch base with them, see where they get their medications, if the pharmacy is open, if they have enough, ask the provider for maybe a month's supply with 2 refills, just so that you have enough. There's a kind of security knowing that you have your medications that are keeping you stable. So it's important to plan ahead and get that done with. Also, your family members will need you more during this time. It's inevitable. It's stressful for everyone. So especially if you're dealing with a mental illness, it's putting extra pressure on you, on top of having to deal with something that's chronic that you've already been having to deal with. So I would just say be an open ear. I know a lot of people are just like Netflixing and TikToking, which is totally fine, but involve someone else in the household in it. Make it a fun activity. Just engage everyone. It's really easy to just become a couch potato. But if you have someone living in the household with mental illness, just check up on them. Even if they, they seem fine. And this is for everyone, mental illness or not, just check up on the people that you love. And if somebody you feel like is reaching for help, then always call 911. If you feel like someone's in crisis, yeah, if you feel like, oh, I'm not sure, but I think this person is a danger to themselves or others, but I'm not going to say anything, this is not the time. You call 911 and we'll assess the situation.
How are you feeling, and how is your team feeling right now? If I was to ask you what the medical community currently is thinking, what would you say?
Okay, so it's actually kind of turned our world upside down. Us in psychiatry, we usually don't touch our patients unless we're doing our medicine rotations. It kind of disrupts the patient doctor dynamic if we do kind of do like a full in detail physical exam. So we're all about talking. We're all about face to face. We're all about, get yourself down to the patient's level, make them feel comfortable. If somebody's dealing with something that's vulnerable, how are you gonna, just bring them down to your level? And that's been really difficult to deal with the COVID crisis, because we don't know, we're on the front lines, as in we're the psychiatric emergency room. People aren't being triaged before they come into us. So any person from the streets can come into our psychiatric emergency room without being screened first. So we are definitely dealing with people that are COVID positive, asymptomatic. We're dealing with people that are COVID positive, confirmed. We're dealing with transferred from different floors in our hospital that are COVID exposed. So we've had to change our get-ups. We've had to change like the whole PPE. We've had to change how we do our interviews. We're no longer obviously staying next to the patients. We're staying 6 feet away. We're not wearing clinic clothes anymore, no professional gear anymore. We're just wearing scrubs just for the safety of us. Because, just as much as we're concerned about our patients, many of my coworkers have gotten sick. And PPE is hard to get. And, we're rationing. We're doing the best that we can. But a lot of people don't understand that even being in psychiatry, being a mental health professional, you're in constant contact with patients. Like I said, ours is the only field that hasn't slowed down. Well, we have the same issues that are dealing with. COVID isn't going to stop mental illness, so there's been a lot of changes. My coworkers and I are trying to keep morale up in the hospital. We try to crack jokes with each other, even in these difficult times, and we definitely protect ourselves with PPE, and we gear up, which is exhausting to put on, but I mean, I take that over getting sick.